Now we move to where the Mental Health Act, Act 846, was passed in 2011. The aim was to ensure the rights and quality treatment of persons with this mental disorder. The Act also requires the establishment of regional review tribunals and formation of visiting committees. These structures are yet to be put in place 11 years after the passage of the Act. The question is, how is the failure to put these in place affecting the well-being of persons with mental illness? Our Upper West Regional Correspondent, Swala Abdul-wahab, joins us from WA to look for answers to these questions. Good afternoon and many thanks for joining us, Swala.
Good afternoon, Dorothy, and thanks for having me.
Now, we are told 11 years after the passage of the Act, these structures are yet to be put in place, structures that is going to help the people with mental disorder at least fit into society. Can you tell us, what have you gathered?
Yes, so what we have gathered is that it is actually the case in the Upper West region here. The Mental Health Act was passed in 2012, and as part of the structures, they are supposed to establish the visiting committees and the regional tribunals. And these committees are supposed to work to improve the well-being of persons with mental illness. We are told by experts that all of us are potential patients of mental illness because we have one form or the other of mental illness. But when it becomes visible that people realize that this person or that person has a mental illness, but it is common to see people with mental illness being maltreated in the streets, in the market, and even sometimes in public. When you see these things, they are very worrying. So the question we ask is, when these people are abused, what have to seek redress? And that is where the need for the establishment of these regional tribunals comes in. We will be talking to someone who has recovered from mental illness to find out what are some of the things they go through when they experience mental illness. We'll also find out from mental health advocates what have they found out to be some of the major problems confronting people with mental illness. And of course, we'll also find out from the mental health directorate what is being done to ensure that some of these things are put in place, and what has been the status of mental health situation in the region. So I have here Mr. Mahmoud Abubakar. He is a recovered mental health patient, to tell us what he has gone through as a mental health patient when he was going through the process. Tell us, how were you received by the society?
So barka ga ja anin yantarma ye onfarma doing jina. Yen yang na anda nin pianga pantanin pin pu. I rel jala ampia. Awo yum pista wajine. To man ka change bu ka tagara kwama nyali ripo. Awul ka baalun la kwama tindi boda ti. Ati bobu po awul ka eman gacha agacha abora ti aba tintile psychiatric nuhin awul ko dan na karate pambana awul ka tinambia psychiatric nuhin ba taka tagara biye be yaga anen fara ne anen ngane.
So what Mba Mahmoud is saying is that he experienced mental health problem about 30 years ago, and when that happened, he resorted to treatment, and the mental health workers were able to attend to him. He was also taken to a psychiatric hospital, and now he is okay. But when it comes to discrimination and stigma, how did you survive it?
Pampana, at Bala being an Ntamanchen and Kanuba Nuhi. Boyu Ntamanchen and can tell him when he's look at Chen Korean in our mansion and Tenet Sayang. Bantera Nuhi. To Asan men, Ndabai Basan, Ndabai and Embasa. Dania Amman Suk, one component, the young Atara and Menjora, or Dania I Menjora a Karen Jim. To man the Ntabajan young and me, to Kablavan, no combine Yelman Nimbri Yang, some Banyan Common Swan Yelman. I will get Manira Bama Iran Tabla. Ampaman Pelimpo, Tababa and 20 Bilan to him, Master, Sona Yalam, Basona Yalaman. I will get Hali Vokan, Mandaman Yalan. But Allah here, I'm Nerma, and no much law got and Canva Juna, quite Mabalong.
Okay, so what Mba Mahmoud is saying is that now when he moves around, people point at him and say that this is the man who is not well, and that for him is a stigma that demoralizes him. And sometimes he even comes across people who used to beat him when he wasn't well and drive him away. So he's saying that mental illness has no respecter of persons. Anybody, any of us ill of mental illness. And so we should not discriminate against people who have mental illness. So that is the message from Mba Mahmoud Abubakar, who is a recovered mental patient. Mba Mahmoud, thank you very much. Barka. Thank you so much. You, Mahmoud.
Yes,
now let me find out from a project officer of an advocacy organization. They have been going to communities to find out how people with mental illness are treated in the communities.
Right.
Tell me, what did you find when you went round? So go back small. So tell us.
Thank you, Mr. Swala. Yeah, I think Mr. Mahmouda have set the tone for the conversation. And when we go to our fields, these are the things that we experience every day. People with mental health conditions are being stigmatized and discriminated every now and then. They are called all sorts of names just because they are suffering from mental health conditions. Some are denied some positions or status in their communities because they had had some mental health conditions. And in our palace, they have it that if you have ever suffered from a mental health condition, it will always be with you. So with that in mind, even if the person is recovered and he is due for a certain position in the community, he is denied such opportunity. So these are some of the issues that we meet in the field. And issues of abuse, and we see it every now and then, either from family members or when they go to traditional or faith-based healers, they go through these abuses every now and then. They are chained and all other kind of treatments.
So what do you do when you see such conditions and situations around?
Yes, with the stigma over the years, we have carried out a number of activities trying to educate people on why they should treat people with mental health conditions with a positive attitude that will help them improve on their conditions. So we have carried out a number of sensitization activities. We have done community debates, we have done radio discussions so that people understand mental health better and they are able to appreciate it and understand it so that they can help them recover.
Okay, so we are picking a question from the anchor so that we move on. Yeah, Dorothy, you can come in.
I think I realize he's answered my question. I wanted to find out about the stigma associated with mental health because it's really a worrying issue. And I wanted to find out what are they doing? What kind of education are they giving to the public to at least accept people with mental disorder, especially survivors?
Yeah, so, yes. So he wants to know specifically what are you doing to ensure that relatives of people with mental illness accept them back into the society?
Okay, thank you very much.
Yeah, briefly, so that I can go to Mr. Basignia.
Okay, so we have a model that we work with, and we work with people with mental health conditions through what we call the self-help groups. And these self-help groups comprises of people with mental health conditions and their primary caregivers. In these meetings, we discuss with them things concerning their conditions so that the relatives can better understand them and they are able to treat them in manners that they are able to recover successfully. So in these self-help groups, we have them across the region that they meet once every month, discuss things concerning them, and once in a while, health personnel and other social workers go around to educate them on some of their rights and all that.
So you've been listening to Mr. George Kumpen explaining to us efforts that are being made to ensure that people with mental illness live a normal life just like any of us in society. Now let's find out the mental health situation in the region. Mr. Sylvester Baseknia is the regional coordinator for mental health. Welcome to Real Time on GBC News.
Thank you for the opportunity.
Yeah, so briefly, how will you describe the mental health situation in the region?
All right, thank you. I must say that mental health in the region gradually is getting the attention of the general public. Why did I say this? Currently, people call us to attend to their relations who have mental health conditions. But earlier, you would find them at the traditional and faith-based healing centers. But for them coming to us now, at least I must say that people are beginning to appreciate that indeed mental illness can be taken care of by the orthodox side. Then I must also say that the traditional and faith-based healing centers, we have established partnership with them. So when they get cases, they call us. Instead of earlier on, they used to resort to chaining them and just keeping them for life. So some even pass on at at such centers. But now they call us when they get cases. And most of them have even stopped the practice. Most of the centers have collapsed. The structures they used to have
Part of the visiting committees. What is the relevance of these committees to your work?
Right. Thanks so much. Per the Mental Health Act, we are supposed to have these review tribunals and the visiting committees. The essence of these structures are to maintain the dignity of persons with mental illness, for society to respect the human rights of persons with mental illness. The visiting committees, they are people that come around, visit health facilities, and then they also audit rumors where they hear that maybe someone's rights, someone with mental illness rights have been abused or trampled upon. So they make investigations, establish the facts, and then they prescribe recommended sanctions to offenders. Then the review tribunals, they equally do the same. At the end of the day, the targets of these two structures is to ensure that the human rights and the dignity of persons with mental illness are restored and then respected in society.
So you are the regional mental health coordinator. How is the lack of these structures affecting your work?
Yes, thanks so much. I must say that in the region, in the country, about 5 regions are on pilot basis. This program has been piloted in the Upper East region, Central region, we have the Ashanti region, Greater, and then Western region on pilot basis. But in the case of Upper West, it has not been scaled up to the region. Like you asked, we still have people who have suffered victimization because of their condition. And we don't have the structures in place to pursue these people, especially maybe someone stoning a person living with mental illness. for just merely going to somewhere, a food vendor for food, or pouring hot water, a food vendor pouring hot water on someone with mental illness who has come to beg for food. These are human rights abuses. But where do you take these people to? At the end of the day, they go scot-free. And so if we had these structures in place, they would follow up or pursue these cases, give them the appropriate sanctions or punishment to serve as deterrence to anyone who would want to do such a thing. So I must say that the absence of these committees in the region are of a grave concern. And we just hope and pray that in the course of the year, maybe the authority would visit these issues and make sure that they are actually related to all the districts, all the regions in the country.
Okay, so thank you very much, Mr. Sylvester Basiglia, for the very elaborate explanation on how the lack of these structures are impacting negatively on your efforts. The hope and expectation of stakeholders in the mental health industry is that this regional tribunal and the visiting committee, which are key in the implementation of the Mental Health Act, will be put in place in the Upper West region. It is being piloted in other 5 regions, so that when persons with mental illness rights are abused, there will be an appropriate place to take those abusers to, so that their rights will be guaranteed. Back to you, Dorothy, in Accra.
So much, Swala Abdul-wahab, for that report. We are very grateful for that and the update you just gave to us.